I'm Riemenschneider, a urologist, and I'm here to discuss the options that we have for our patients. We treat both men and women, and today we're going to focus on what we can do for men who have urinary control problems and how we can use our technologies to solve them. The prostate is a very centrally located organ. Within the prostate are certain muscle groups known as sphincters. We might call them shutoff valves. But that's not the whole story, because the reason that we are able to control our urine relates in large to how the bladder itself works. We can print out the physical relationships that will allow us to understand why you are having problems controlling your urine. Now, if this is related to the bladder, it'll be very obvious. If it's related to the sphincters, not quite so much. So we have to do some other types of testing, which mean we look in through the channel through which the urine passes, and we can tell if there's problems, possibly as a result of prior treatments such as radiation or surgery. But what we really want to do is be able to go out in the golf course, play 9 holes, and not have wet pants. And we can make that happen if this is your problem. Dr. Scott developed the artificial urinary sphincter. It went through a number of changes, and I was fortunate enough to be a part of that. These innovations have really materialized into a very reliable system that we use quite frequently today. And that's this device, which you see here. It's a multi-component system. It's entirely contained within the body. It's totally implanted. And it consists of a reservoir, a pump, and a cuff. So here's a brief sequence of how the artificial sphincter works. With the bladder full, the cuff is full, there's resistance, and urine can't pass out. When the pump is manipulated, the fluid is shifted, and the resistance in the urethra is now relaxed, and urine can flow easily. And after about 3 minutes, the pressure that is generated in the reservoir by pumping the fluid into it bleeds back into the cuff, and in 3 minutes, the cuff is again inflated, the resistance is back, and the patient, you, are dry. The problem of wet pants is a problem for everybody. But guys, I know that we all are very concerned about things such as prostate cancer, and clearly today there's marvelous things we can do for that problem. But the issue of leaking urine after having successful treatment for prostate cancer is real. We have an office that when you walk into it, it's a safe zone. It won't take you long to figure that out. The people who will greet you will do their darndest to make you smile. They'll know you by name, really know you by name before you leave. And when you call up, there's a good chance you'll ask for the receptionist who said goodbye to you. When you want us, you'll have a phone number to call, and by gosh, we'll answer it. There are many things we can do for you, but I ask just one thing. Please tell us exactly what's bothering you. And if we can't solve your problem, we know somebody who can, and we'll make sure you get there. Thanks for coming. I'm looking forward to seeing you.